here with Dr. Amy Brenner today, and we're going to go ahead and do her second laser hair removal treatment with our Gentle Max Pro system, which is top of the line on the market. I personally had my axilla treated, or my armpits treated, 2 times. I'm not growing any hair, and I'm absolutely thrilled about it. And Amy's kind of had the same experience with her Brazilian, which we're going to do her second treatment today. So first, what I'm going to show you is our screen. And so as you can see, this laser is indicated for hair removal, but it also treats pigmented lesions and vascular lesions. So we're going to go ahead and pick her settings right now. So because we're treating the bikini area, her hair color is dark, the thickness is coarse, and then we can base your treatment on your skin type. And the great thing about this laser is we treat all skin types, so no one's excluded. But I do want to make a note, the hair does have to have pigment in it, including red hair. The only hair we cannot treat with the laser is blonde hair, white hair, or gray hair.
Yeah, we were just talking about that. I'm like, I'm on a time crunch now because I'm certainly getting gray quickly, so I need to hurry up and laser it while it still has pigment to it.
Absolutely. The last thing you're going to see when we pick our settings is that you cannot have a tan, so very important. So being the summer months, or some areas like the face we're going to be limited in treating, but luckily most people don't have a tan in their bikini area, so we can go ahead and treat that today. So go ahead and pick that.
Yeah, as she mentioned, I've treated, since I spent a lot of time at Lake Cumberland this summer, I've treated my armpits, which is great. Even after just 2 treatments, I hardly have to shave, and then I've done the Brazilian area too, and we'll be doing my legs as soon as my tan fades in the fall.
Good. Okay, so just adjusting my settings here. Now we're ready to go. We're all going to put our protective eyewear on. Very important when you're talking about lasers. Here's some goggles for you. Quick calibration.
Okay, hand me those goggles down there.
So I would say one of the best things we found about this laser is the comfort of treatment. You absolutely can't say that regarding all lasers, especially some that are using more light therapy. And so Amy's going to kind of tell you about her experience and just how different this feels than traditional.
Yeah. Our old laser, in my opinion, was just really uncomfortable. If you were ever in the office when I had it, you could probably hear me from anywhere that you were. And this laser really just feels like somebody's spraying like a can of hairspray at you.
Ready? Yes, ready to go. Okay. Okay, so we're going to go ahead and get started. How are you feeling, Amy?
Yeah, it's fine.
So you can see it's just so easy to do, very, very quick.
And unlike some other lasers, you don't have to use gel with this, so it's not messy at all.
Now, it's very important that once you do your first treatment, that you come back in the schedule that you were given. So depending on the area of the body, we're going to ask some people to come back every 4 weeks, others every 6 weeks. If you miss that time frame, you will actually completely negate your treatment. It's almost like you didn't have anything done. So very important to follow those instructions.
I actually treated my 14-year-old daughter, her armpits too, and obviously she was really nervous, and then when I started treating it, she's like, "Are you doing it yet?"
And Dr. Tiemann, how many treatments will Dr. Brenner need?
6 treatments.
6 treatments. And how far apart for this area typically?
So in the bikini Brazilian area, or including legs, upper arms, we'd recommend treating every 6 to 8 weeks.
Okay.
Yeah, when you're treating the face and the armpits, okay to do every 4 weeks, just based on how that hair grows in that area.
Mm-hmm.
Great.
Okay.
All right. Perfect. Well, thanks
That's
for
it?
joining us today.
That was fast. Wonderful. How do you feel, Dr. Brenner?
Oh, fine. Like I said,
Okay.
it doesn't really feel like anything.
Wonderful. Thank you, Dr. Tiemann and Dr. Brenner.
Thanks so much.